Sciatic nerve injury, often abbreviated as SNI in medical literature, is a topic of considerable importance for veterinary professionals and pet owners alike, as it can significantly impact an animal's mobility and overall well-being. While reports on such injuries and their consequences are somewhat limited in the realm of veterinary medicine, this study provides valuable insights into this condition. The sciatic nerve is a major nerve in the hind limb, essentially formed by the close association of the tibial and common peroneal nerves. These two branches can separate at various points along their course, from the hip joint down towards the space behind the knee. Depending on where an injury occurs, either one or both of these branches can be affected. It has been noted that injuries impacting the main trunk of the sciatic nerve or both the tibial and common peroneal branches tend to have a less favorable outlook. Regardless of the specifics of the injury, the eventual outcome is strongly influenced by the severity of the damage at a functional level. For instance, if there is a complete severing of the nerve fibers and the surrounding connective tissues, a condition known as neurotmesis, the prognosis is generally poor. In contrast, axonotmesis, where some nerve fibers are damaged but the connective tissue framework remains intact, presents a more variable prognosis. Finally, neuropraxia involves minimal structural damage, often just a localized disruption of the insulating layer around the nerve fibers, and these cases typically see a spontaneous recovery within days. However, the return of function can take weeks or even months, depending on the distance the nerve needs to regrow to reach the affected muscles. To better understand the extent of nerve damage, veterinary neurologists rely on thorough neurological examinations and electrodiagnostic tests. These tests help estimate the functional impairment of the nerve fibers. While such methods have been used to predict outcomes in other types of nerve injuries, such as those affecting the brachial plexus in the front limbs, specific investigations into their predictive power for sciatic nerve injuries in dogs and cats have been relatively scarce. Furthermore, there has been a lack of information regarding the quality of life experienced by these injured animals and the perceptions of their owners.
Overall, the study highlights that while sciatic nerve injuries can be challenging, clinical motor function appears to be a stronger predictor of recovery than sensory function, and electrodiagnostic tests play a crucial role in further refining our understanding of the likely outcome. The encouraging reports of good quality of life, even in severe cases, provide reassurance to owners facing this difficult situation.